Good morning.
Financial report.
Can I get a verbal okay that you can see my screen?
Yes, you
Okay.
can.
Perfect. Okay, so we're going to start off here. This is the March kind of financial recap. So financial performance for March. Just specific to this month, we see that gross patient revenue came in at $2 million compared to where we had budgeted at 2.2. We also see kind of a unique situation in which we have a benefit from our contractual line. So it comes up as kind of a negative contractual. And what that is resulting from is really the hard work that's been done over the last 2 months. January and February, we saw really high swing bed and inpatient days. And those days get reimbursed. The majority of those days get reimbursed through Medicare based on our cost. And that cost is higher than our charge. So what happens is when we get paid that amount, and we'll kind of get into numbers for volume here shortly, but when we get paid that amount, it becomes a negative contractual, which means we benefit. So we see a benefit of $82,000 to the contractual line here for this month, which results in total operating revenue of $2.1 million for the month, compared to where we had budgeted total operating revenue of $1.8 million. We see total operating expenses come in at $2.3 million compared to where we had budgeted at 2.2, and that leaves us with an operating loss for the month of $135,000 comparatively to where we budgeted of $358,000. When we factor in the non-operating revenue to that, we then see the total net loss for the month is $16,000 compared to where we had budgeted of $230,000, excuse me. How that looks year to date then, we actually see our gross patient revenue is trending higher than prior years, so 7% greater. The contractual adjustments are lower, playing into, we're seeing those swing bed days getting reimbursed at a higher rate, so our contractuals come down. They're sitting at 14% year to date compared to where we ended the year at 20%. Total operating revenue is 10% greater than prior year, and our total operating expenses is trending right along that same route of 10% greater than prior year as well. So comparatively, you see the net loss year to date through March for 2025 is $330,000. Compared to last year, the net loss was $189,000. For volumes, what we see in this month is specifically inpatient swing bed days are totaling 45 compared to where we budgeted at 47. Outpatient services were slightly behind for the month where we budgeted by 8%. ER room visits were 226 compared to our budget of 192. And the care center occupancy was sitting at 72%, 72.5%, I should say, compared to 74. How that looks year to date, so we see the acute patient days at 34 compared to 39 in prior year, but then this next line, the swing bed patient days, we see that really big jump I was just talking about. We see 187 days through March compared to last year at this time of 56. PT, OT, overall, those modalities have increased 3% from prior year, and our home health visits are totaling 137 year to date compared to 123 in prior year. How that looks on our financial indicator scorecard then, so we see operating margin is in the green, we're sitting at negative 6.3, and this is all compared to our budgeted benchmark for the month. Same with operating margin year to date, we're at negative 12.3, that's sitting in the green comparatively to where we had budgeted year to date. And then net margin is at negative 5.3 currently through March. Days cash on hand are sitting at 199. That is sitting in the green compared to our benchmark, our minimum target of 85 days. We do see the days revenue and accounts receivable flip over into that yellow range now. So just looking kind of year, since where we landed in AR at the end of December through now, so in those first 90 days of the year, we've seen that our AR in total, our gross AR has decreased $957,000. And of that decrease, it's not just a factor of having lower revenues in this current month. 41% of that decrease was actually aged 90 days and greater. So we're having positive trends on our collections, which also plays into the bad debt, the provision of bad debt that we have within our financials, which benefit that plays into that deductions line in which we actually saw benefit this month. So positive outcomes that we're seeing on the receivable side. Then when we look at current ratio, we're sitting at 3.22. Comparatively, our benchmark is 2.5. And our debt service coverage ratio on the rolling trend is currently sitting at 1.07 compared to the target goal of 1.25. When we look at the forecast,
sorry, real quick.
I'm sorry, was there a question?
If you go back to the last slide, why is the last one, debt to service coverage ratio, if the goal is 1.25, and it's below that, why is it, or you want to get it up to it? I'm sorry.
Yeah, we want to get higher than 1.25. So your debt service coverage ratio is really looking at your net operating income and dividing that operating income by any current. So current within this kind of fiscal year, typically we're looking at a year-to-date debt service, but in this situation we're looking at a rolling. So it's looking at any current principal and interest payments that you have upcoming. So one trend that I've seen a lot of in many facilities that are governmental is that this debt service coverage ratio has actually been a little bit lower for many facilities over the last year because there was an implementation under GASB in which you have to show on your balance sheet all of your lease liabilities that meet a certain criteria. So while this is in the red here on our rolling range, our goal is to have it on the rolling range above 1.25. Our year-to-date range is actually sitting a little bit higher. So currently when we see March of 1.07, our year-to-date for March is sitting at 1.10. So there is a little bit of variance in how we look at this, but that the rolling 12-month actually has a little bit more conservatism built into it. So the goal is to get above 1.25 on that rolling basis. So it is sitting in the red. We will also see here as we get kind of our audited numbers finalized if there are any impacts for the end of the year for December of 24. But right now, this is really your rolling picture. So this is our target of trying to be 1.25 on a 12-month rolling basis.
That's really helpful background. Thank you. Could we get the greater than sign just added to that 1.25 in the bottom right dot?
Yep.
I think that's why I was thinking it was distance from the mean, but that makes sense if it's greater than. And then, is it possible to also get this slide included in the financials delivered or included in the board material?
Yeah. Yep, we could put that in the financial package as well.
And it's great to see that trend, as you noted, in days accounts receivable heading in the direction that we expected. So that's awesome to see. Thank you.
Yeah, yep. It speaks a lot to the work that's being done within our business office and our outsourced teams as well. So then looking into the financial forecast, what we see is really the financial forecast is taking what your actual trend for the first 3 months, what we've seen actuals plus the budgeted. So where we land with the financial forecast is 1% ahead of budget, operating expenses within that budget, and then income from operations is forecasted to be a loss of $1.8 million. Net loss for the year would then be forecasted at $224,000. Looking at this kind of with our trend line again, you see the yellow line is the actuals for fiscal 2024. The green line is actual year to date, fiscal 25, and then that blue line is budget. So we're seeing a little bit of variance. We definitely see positive trend compared to budget, which is great. But even within the budget, we've got an increase that we anticipate over the end of the year. So we're in a good spot compared to budget, slightly behind where we were last year. And that does include, this trend line does include a lot of your non-operating income too. So a big thing that we're seeing is fluctuations within the market. So we've seen a sizable variance in what we've seen in investment income year to date, just given where the markets are comparatively to last year. So that is one of the factors to keep in mind as well here as we look at fiscal 24 to fiscal 25. And with that being said, are there any questions?
No questions? Okay, so need a motion to accept the financial reports?
I'll move.
Second. All in favor?
Aye.
Thank you, Nicole.
Thank you.
Very nice. Okay, next up, we have a presentation from Patrick O'Neill. You're in charge of our rehab department, so the floor is yours.
Awesome, thank you.
Is it possible to turn the closed captions on? Those of us who with cochlear implants can't use your personal application devices.
I don't have closed caption.
Yeah, I don't think there.
Most of these programs have a closed caption feature somewhere, but if not today, maybe somebody could look for it in the meantime.
I think we certainly can try to in the future. I think that just to get that information, it's a great call out, but unless anybody else knows, it would just be us kind of fumbling through trying to change this.
Just have Patrick change my code.
Is that helpful?
Is what helpful?
The volume?
Marginally, but
Marginally. Okay, I'll speak louder then.
Patrick, pull it towards you.
it's complicated.
Yeah.
There you go.
There you
Go
go.
like this, hopefully that's
Yeah,
better.
That's good.
Yes.
All right, as I was introduced, I'm Patrick O'Neill. I'm the new director of rehab. I've been in this role for about half a year now. Stepped up from physical therapy lead into this position, and I'll get into the fun stuff. So I inherited an awesome team under the previous predecessor, Sharon. We've had a lot of exciting changes within the last 6 months for sure. With the hiring of 2 full-time occupational therapists, and in 2 weeks we will have a full-time physical therapist coming on board. So we're excited about the staffing. We're seeing a nice improvement in patients being able to get in at a faster rate that's more acceptable. So that's been exciting and helps alleviate a lot of the stress on our therapists. You can obviously see that a bunch of physical therapists and occupational therapists, we like to be outside. So we're very excited to introduce our pediatrics. Oh, is there a question? Oh, gotcha. Very excited to introduce our new pediatric summer intensive program. We're adding in 3 specialties, so that's PT, OT, and speech. Anna Sorensen, Andrew, and Haley. Haley is coming down from Thunder Bay 3 days per week. In person, which that's a service we have not provided ever up to this point. And in general with pediatric therapy, these summer intensives, we are now having people not having to drive to Duluth. They're getting the care here, saving them 220-mile round trip. And families are very happy and thankful about that. We're also excited for this. This is a huge benefit, and there's a lot of talk within the schools as well too, because these kids, you'll see, if they can get once or twice, yeah, they'll make some progress, but if they get these big intensives and short bouts, all of a sudden you see a huge jump in progress, and then you can maintain from there. So it's a huge benefit and asset to the community.
So Patrick, I have a question. You are going to be working with the schools?
Not with the schools, but we do have, it'll be in conjunction with their IEPs, so their action plans that they have through the schools. So we're able to kind of coordinate, and then once summer's through, they'll go back to the school at that point. It's a great problem to have. We're already full. If there's others, we'll figure out how to get them on the schedule, but we're busting at the seams already, so that's great. We're already booked through August. So another exciting thing we just have access to in the last week here, it's called FOTO, Focus on Therapeutic Outcomes. Currently, there's no mandated reporting on our end as to tracking outcomes. We're going to be an early adopter of this, and it's going to be beneficial from not only patient outcomes, but us being able to identify, okay, where are some of these successes, and giving the success and credit to our therapists by tracking this. I think if I saw correctly, and Kimber, please correct me if I'm wrong, but there was some changes, not towards our facility, but for fiscal year 2026, where they're starting to have some more outcome-based criteria for reimbursement. The nice part is if that ever does come down the pipeline, we will already be prepared and ready for that. So, awesome. Yeah. That's my most boring picture, so I apologize for that. Solo Step, updated equipment. So we've got a lot of changes kind of coming through here. This has been amazing to integrate, and it's a huge thanks going to Lloyd K. Johnson and being able to fund this. As you can see on the side there, it's a harness and overhead track system. We've used it from the hospital to the care center, outpatient. People have seen it and they're like, how do I get using that? It's just a huge trust builder. And we have an attachment not shown that goes over a treadmill. So, individuals with strokes or, just weakness, they can get the care that they need without having to go to Duluth. So it's been amazing. That's all I have for you.
Patrick, that's really awesome work in general, and I can speak from personal experience in terms of our family, the pediatric stuff. Like, it has just been an awesome team that you guys have pulled together and continue to be part of. So thank you. And I know that the way you guys try to do these summer intensives was like, oh, fantastic, because you can, as you said, tackle a specific issue, and then you see a lot of growth. So from a personal perspective, you and the whole team, it's going awesome. How many, do you just have an idea of how many folks don't have, like, just raw numbers, like when you break up this equipment, are not having to go to Duluth because this is now here as a new service, and then just whether it's miles or time or just, do you have a sense of that?
Not a more recent one. Back when we tracked it for the first, it was like 13 right off of the bat, which is a huge for our population. But I haven't tracked that in the last 3 months. I'd be guessing, I don't know.
13, that's awesome.
And then it's more miles depending on where you live in the county.
Sure.
From Grand Portage, it's a 300 mile round trip, and then if you count the trail, it's pushing that too. So, and it's good that you're going to be doing some of these things in the summertime when you talk about children. And you're right, like for the speech therapy, when it drops off at the end of the school year, there's a leg, and then you got to start again anew, when the school starts. So if you can keep working with those children during the school year and the summer, it's just going to give them miles ahead of where they're going to be. So good gains.
Absolutely, and that reflects everything that the literature shows. So yeah, thank you.
Yeah, another personal anecdote to say, really cool about the children. One of my daughters, and they're getting up there in age now, but when Beth was preschool, she had speech issues. And we got her, this was in the transition, we got her to a speech therapist, and it went really well, and by the time she was in later grade school, she was like a stand-up spelling bee champ. And later on, testing, she was like 99%er academically. So like, the speech therapy at a young age was just, I'm convinced, it was just, she could have stayed in this limbo of not being good enough. Instead,
and that's what we're seeing as well too.
Yeah.
Yeah. Confirms my biases. So.
Confirmation bias is not always a bad.
And I think during the school year too, most of the kids end up doing speech therapy, and it's electronically, and it works. But it's very great that we have somebody coming down, and there's a one-on-one and a physical interaction. So this is good, really, really good.
Even occupational therapy, Anna was for the longest time, up to about 2 years ago, I believe, the only occupational therapist in the entire county. Right. So that's been awesome to see their numbers start to grow.
So Patrick, I always have this question for department managers. What's on your wish list?
Ooh.
Caveat here, it's a wish list.
That's a great question. Yeah. Some of the current resources that we have, a lot of it is day-to-day type stuff, but our big wish list is to supplement some of the solo step type stuff. It would be getting different parallel bars that adjust. So the therapists right now, our current ones, you have to like pull it and then lift it and go, and it works and it's very stable. But if you're talking about maximizing the efficiency with the use of the patient, it's having an electronic version of that is going to be on my next list. And then Nicole might be a better. I think she has like 6 things from me coming down the pipeline here, so we're working on prioritizing which ones are good.
Okay. Well, good luck.
Thank you.
We'll do what we can on this side, maybe.
Appreciate it.
Yeah, for sure. So, any other questions, or Patty?
No, that's
Anything
good,
else?
yeah,
No?
yeah.
Good. Well, Patrick, thank you so much for
Thanks.
joining us
Thank you.
today.
Yep.
Keep up the good work, and we'll see you around.
See you around. Thank you.
Thanks.
Okay, we're moving on to old business. We're going to start off with the 2024-2027 strategic plan update. Any board members have any questions after reviewing the information?
No, I see we've got some things coming up to complete here in May, and I'm hoping we're on track for that.
And I think the big one, actually the one that I want to highlight and also remind you as the board and others, and it is also the management report, is the follow-up now with the healthcare needs assessment. And so on the 29th is the presentation for the boards, both SMC and North Shore Health. That'll be in the lower level of the clinic. And then that evening at 5 o'clock, we'll be up in Grand Portage. And then the next day on the 30th, trying to make sure my days are right, at 10 o'clock over at the Grand Marais, the community center. And we're still working on.
Are you still working on that?
Yep.
I appreciate, I really do appreciate that.
We will get,
And the other question
almost
is maybe
positive.
somebody, maybe somebody could record at least one of those sessions so that if we don't get a Zoom, I'm really interested in making sure that I get to see that, but I'm not quite willing to drive 1,200 miles.
I'm sorry, I might have missed this. So there are 2 public meetings?
to public
Yep.
meetings.
Okay, and then our meeting, which is, so we have a closed meeting with the 2 boards before, or is that a public meeting?
It's a public meeting.
Okay, and where did we post these 3?
They have not been posted yet, the board ones. The first one is really intended for the boards.
Were the other 2 though, the public ones? This is the first time hearing about the other 2.
The other 2 is, and they will be, invitations have been emailed to those individuals who participated in the focus groups. So those have been emailed to those people individually already. That was done last week. And then it will be in the paper next week, so it's right the week before. So if there are others that would like to participate. And it will be the 29th at 5 o'clock in Grand Portage at their community center.
Is the community center or the EMP?
No, community center,
Community
because
center.
ENP is having
They're
remodeling.
renovating, yeah, okay.
So,
I was worried
back,
that was.
I would get to that.
All right.
And then on the 30th at 10 o'clock in Grand Marais at the community center.
Yeah. You know, and I think both places have the ability to do Zoom, if you wanted to Zoom that. You just, I know for Portage, you just have to get a hold of them, and then the IT would have to set that up.
And we've been working through that. But I think we're trying to get for Dr. Schmidt with the boards.
I do appreciate that, thank you.
And I just want to be clear, so this is for not just those who were in the focus groups initially, this is kind of the report out to the community at large. Or is it the report just to those focus groups and there's another then step, which is the community?
No, this is the ultimate report out, but it's definitely going to be those individuals that had participated in the focus group were those who had requested this, and so it was specifically, they were specifically invited, and then the others were saying, well, let's open it to the community, and that's why we put it in the paper, and it'll be on the social media as well for individuals who want to participate as well.
No other questions? Okay. So continuing with our old business, our last meeting we talked about potential engagement with Matt Anderson to do some board coaching. And in your packet, we have a proposal from him. I don't know if everybody's had a chance to look at it. Find it? No, it's right here. It's right here. Yeah, Mr. Anderson was kind enough to sit down with us and come up with an objective and a timeline and some activities and a work product for this work. Essentially, giving us the opportunity to work with him as an advisor, as a coach, to help understand our roles much more effectively, and to give us some guidance on how can we best serve the organization, and by doing that, we serve the folks of Cook County and anybody who comes to the hospital.
Do we need a motion to proceed with that?
I just wanted to open it up for discussion.
Okay.
And you know, if you have any questions, I know everybody has it in the packet here. There'll be a kickoff discussion, and just to go through the proposal. There'll be then one-on-one meetings with each board member, 30 to 60 minutes. Ideally, Anderson's observations would be either joining us physically at the meeting to observe how things go, or he can do it remotely, give us feedback, and then have ongoing coaching, individual coaching. Also, as part of the project, he would help us come up with trustee job descriptions, shared standard behavior code of expectations, and a board self-assessment survey tool. So those are basics. The fees would be an hourly fee of $200, not to exceed a total of $8,500. So those are the essentials. Mr. Anderson said that if we wanted to go forward, we could begin this process in May. And so he's ready to go if we choose to.
Since we're talking comments, I think this is a great use of board time and hospital money. I think it's very important for us to do everything we can along this line. I think we all know and trust Matt Anderson from his previous work with us. So I reviewed the proposal, and it looks very good to me. So that's my comment.
Okay.
Yeah, I'm excited about this, especially the documents that he'll help us generate, which I think is important now and for the future. It's exciting, but this is expensive.
This is, I think from a values perspective, you know, it's coming out at about 42 hours worth of work. This is, I don't know, I'm not worried about the value of that, especially because I appreciate deliverables put into that. So I think that that price tag, and if it hits 8,500, which it says is the cap, is in my mind absolutely money well spent with the objective of us working better to lead the organization as a unit. One question I've got is individual coaching is mentioned in here, but it's not mentioned what the deliverable expectations are of that, or the amount of time, considering, you know, we've got $8,500 in there total, that comes out to about 42 hours. How much are you thinking that we might have in the future of that? Or does that piece just come out and the first meetings, that may be the future phase?
Yeah, I think to your point, we did talk about that when we were preparing, as he was preparing this approach, and he said, you know, it's like anything else. You've got all of the folks here. Everybody is at a different spot, maybe for certain things. So I may need more on communication. Patty may need more on technical something. Milo needs to know how to turn his documents.
Yeah, right. Well, actually, Kimber already took care of that.
Okay, so there you go.
No, I think that makes a lot of sense.
Yeah,
If we
so-
can get it phased, because then Patty, to your point, then we also can make sure we're not including too much in that first one, and boom, we hit the 8,500. So maybe put it in a phase.
Yeah. And Matt's very, very reasonable. You know, he's been great to work with over the years. And I think one of the final benefits too is it brings us looking at the time frame, this is not a forever project.
Help us be more effective in strategic planning, and we won't have to spend quite as much time figuring out where we are. So I think it's
Well said, well
really.
said, well said. Okay. Sounds good. Steve?
I'm getting excited.
Okay.
I respect him a great deal. I can see the value.
Well, I'd like to make a motion to approve this project.
Second.
All in favor?
Aye.
All right.
Sounds good. We'll get a hold of Matt probably today. Get him on the ball here, so, sounds good. Next, under old business is continuing our discussion on the board confidentiality agreements. I know Mylan and Patty, you've been involved.
We had a Zoom meeting with Kimber and with Tim, and I thought it went pretty well. But we're not quite to the point of having a new agreement to discuss just yet. The information, the red line version of Tim's previous document I received it an hour before the meeting, so that wasn't really enough time for me to get a good thorough look at it. So we basically agreed to continue to look at that. Kimber's going to get us some more documents to look at. We're going to hopefully have something to present in May.
Yeah.
So that's kind of the timeline. I could say a lot else about it, but I don't want to waste anybody else's time. It's good to
Fair
be
enough.
going on.
Good. Fair enough.
We're working on it, we'll have something for you in May.
Yeah.
Can I just ask for clarification, Mylan? You mentioned that you got the red line.
Oh, yeah.
The red
So
line copy an hour before.
this was
What
this
is it?
was his previous document, and he made some changes to it, many of which were
Okay.
good.
As I recall, though, the motion was to void the document completely, take it into consideration, as Steve said, but from a legal perspective, I think we need to start with it would help you to start with your conversations with a brand new document, not looking at a redlined contract and thinking about it as a next version.
Well, I think we'll take that into consideration too, and I think there is work to be done, and I think the word was hopefully we will have something by May. I think we maybe can.
I
yeah.
mean, that's the goal. I mean,
That's the
what
goal.
we're-
So
yes.
that's where we are,
Awesome.
and I'm already working on a version from scratch, and we'll see. I don't know if Patty is or not, but and then we've got versions that'll be coming in from Kimber, from other facilities. So yeah, so we're not limiting ourselves to that particular document.
Sounds good.
Okay. Steve, anything?
I think I'd agree with that.
Well, sounds good, yeah. It sounds like you're making good progress. And so the final piece in our old business is evaluation of video recording, publishing of board meetings. And Sam, I know you put together a summary of some good talking points. I think overall, this is a good start in terms of the issues that we need to cover related to video recording. I mean, we have experience now with WTIP thoughtfully recording us. So I see the camera's in a different spot. Are we not getting everybody's head this time? Is that?
No, the goal is to get the board. That's the goal.
Okay, sounds good. I just had that comment. So I'd like to just open it up. Any comments from various board members on what's been presented so far?
This to me is a start, again, we have to figure out cost. There are, some legal ramifications about this and some other things. So this hits the things that we need to consider. But, we need more work and more thought on this. So thank you for putting this together, Sam.
What is the specifics that you're looking for, I guess? Because cost, we've asked, which is just people's time at the moment, unless there has to be a hardware update to that. In doing kind of testing for different scenarios, if you look at the workflow that's on the last page, there should be no cost. The YouTube channel is already managed by us, and that's free. There's an additional, I guess, cloud hosting cost, but it's a 3-hour, video that's absolutely pennies on it. Oh, actually, no, we're not in the cloud, so it's not even cloud hosting cost. So that's a flat cost. And
Well,
I just want to make
first
sure
of
I'm
all-
getting
First
this.
of all, I don't understand the cloud, so I'm starting at a really low understanding here. But it's, you know, the cost for the equipment, the cost of the staff to maintain it, the cost of storing it, and how long, and how, you know, who has access. I mean, I have a lot of questions about this yet, so you brought up what we need to consider, but I think we still need to discuss this. I'm not ready to sign off on this yet, and as far as cost, WTIP is doing this as a public service, which is kind of your mandate, I would think, as a public radio. And if they're already doing it, then I don't know that we have to do it because it's kind of done. And it doesn't cost us anything, and we saw what our budget and how things are going. My feeling, and you know, I'm not an expert in any way, but you get technology, and within a year or two, you got to upgrade it, you know, to keep current. So I'm hesitant. I have more questions before I can sign off on this. That's what I'm saying.
Gotcha, and I absolutely respect that. I think I would welcome feedback, as in the direction this is taken. My hope would be that we can come together as a group and really make a motion for this next month. I want to be clear on a hardware thing. All we have to do is hit a button that says record, and exactly what you see up there, which is every single one of us, is recorded. So yes, WTIP has it. If we wanted to look at a partnership with WTIP, that's a formal piece, and we say we want to make sure the camera's in the right place and the audio really works, we've got closed captioning. I'm certainly interested, I think, in that conversation as well, but I think the reason I'm a little frustrated is we're making this a much harder deal than I think it is. I did call out considerations, and I just want to make sure that the group kind of says, we are approaching this proactively and with steps in order for us to be able to make a motion and really start recording this. I would say if not next month, the month after that. We just kind of need to be able to double down on that. So if we do need the legal review, I think we'll need to get our legal involved to give a quick answer to that, and we can send an email to them this week. The hardware piece of that, I know that the team is pulling together information on that, and we should have it next week exactly from the hardware. I can put more descriptions in the workflow as well, but my goal would be that next month we'd be able to have a motion and vote on it as long as we have those pieces to it.
And I think it would be helpful, you know, we'd said that we'd have a subcommittee, so to have Randy and you and members of our team kind of get together to be able to do that, I think would also be helpful for us to continue to gather information.
Yeah, no, I think this is a measured approach, and I think that's the best way as far as, you know, looking at this. One thing to also we also have to consider as far as, you know, getting an opinion from our legal counsel and in surveying. I know we've done some surveys of other facilities, but purely from a requirement standpoint, there's no statute in Minnesota law or federal law that requires recording or streaming of any information, and so I think that needs to be carefully considered. The other piece too is the administrative component of it, and you know, anytime we put something in place, a process in place that gets embedded in the organization, there's administrative overhead that, well, on the surface may not look like it's complicated. It could get complicated. So that's, I guess, the best route here of what I'm hearing is that, you know, we'll come back with some more information next month, and when we have, you know, dollars, cents, some more information on what the true administrative cost is. I guess that's the big concern as far as the organization, retention of the information, storage, etc. And if we can mitigate that.
I think there's also, you know, it's hard to measure the administrative burden, but it's also hard to measure the community benefit. And so, you know, to say that we're not required to do this, right? But we're going above and beyond on a whole lot of things. Okay, we just heard from physical therapy how we're doing above and beyond. We've had a lot of other pieces. We're going above and beyond with our board education. I think going above and beyond with community involvement and education is also an important piece.
What's that?
Don't disagree at all. Don't disagree with that.
There you go.
Yes, we do. Well, we do make decisions with complete data.
Yes,
Yeah.
Okay.
we do.
So here we go.
As complete as possible.
That's all we can do. That's all we can do. So.
Yeah, I just have a little, and I'm just a little concerned about becoming committed to something and then sustaining it, and then the liability if we don't manage to sustain it.
Yep.
Just what does that look like? And I don't, that's a very,
No, that's a good
I'm
call.
curious.
That would be
about-
something for the attorney to be,
Yeah.
that's why we're having legal review.
Exactly.
Yep.
Yeah, and the group
Yeah,
getting
right.
together to try to answer some of those questions or as best we can.
So, sounds to me like, we'll continue the conversation next month, so we'll have an update, further
Sounds
update. I think we also wanted to connect with the county folks too, just to see what their experiences been. Yeah. So, okay. Sounds good.
Yep,
Thanks, Ann.
sounds good, thank you.
Okay. All right, new business. Financial assistance policies. We've got a detailed policy in our board packet. Does anybody have any comments or questions on it? Nicole, would you like to chat about it for a minute?
Well, and when you say hit though, we're
Yeah,
talking
so-
about multiple policies, correct?
Yes.
Right.
Yes.
Okay.
There's multiple policies. Is there,
Yeah,
want to give us
so
the highlights?
these
from your
policies,
perspective?
there's a cover sheet that kind of lists out the financial assistance policies. These policies go through a review annually, so we sit down with our team, we look at not just the pieces of the policy, but also the related regulations, the Minnesota Attorney General pieces. We look at annually the federal poverty guidelines that play into these pieces as well. We roll back through all of our forms, make sure that the process is matching up and meeting our policy from a standards set point. So within these policies, there have not been significant changes. We've revised some of the roles, titles, some of our approval limits internally. But there are, to the core of these policies, there's nothing significant that has changed beyond our annual updates and ensuring that we're meeting the regulations. Are there any specific questions in regards to these policies or processes?
Yeah, I have one question.
Yeah.
As we, have financial turbulence in this country right now, our debt collection policy, I know that comes up a lot in healthcare.
Yeah. Yeah.
Can you maybe give us a warm fuzzy on that?
Well, so
we always get
here's the
targeted,
deal.
households get targeted as bad
What I
actors.
should call out is really our financial assistance program, right? So as we see changes within the political environment that we have, and as these political changes impact our families within the community, one piece as a facility within Minnesota that we offer and under the Minnesota Attorney General's regulations too, is what we call community care or financial assistance program. And what that is really a program set up to help us identify, navigate, and help let's say we'll take family as kind of the example. It may not just always be one individual, it may be a family. Help those navigate changes, whether it's changes within their insurance or maybe they're uninsured, getting them, I'm going to say discounted care under our set standards, and then helping them find the next piece of coverage that they need, whether it be through the state or the federal available programs, right? So what I